welcome. There's no other way to change this around except to just keep it the same. As everybody has said, we got all kinds of emails. So I'm keeping it the same. Welcome. Welcome to you and you and you and you. Welcome to the law, your money and you. I'm Roberta Saphire, an attorney in Sharon, Massachusetts, USA.
Hi, I'm Camille Barron. I'm a healthcare advisor and financial coordinator, also in Sharon, Massachusetts, USA. Welcome, everybody.
Yes, and we welcome to join us as one of our hostesses for the day is Rebecca Greenberg, who's our operational manager, and she is on all the tapes. You just don't see her, but we figured she had such great questions. I said, well, why don't you come on and you can help, because this is one program I need help with. So Rebecca, introduce yourself to the people.
My name is Rebecca Greenberg. I'm an attorney and I work as the operational director for the Law, Your Money and You, and help out as much as I can.
Yeah, you've been with us about 2.5 years now.
Yeah. Right. And before that, I was with the federal court for about 27 years.
Oh boy, and she's only 26.
You're my best friend.
Well, good. But anyway, this topic has been asked for so many times, and as far as experts are concerned, we feel Camille is probably the best expert out there. And I have to confess, although I know a lot about the law, it seems I know nothing about the medical and medical insurance, and I just can't understand it. And that's why I'm hoping that Camille can explain. So go ahead, Camille. Start talking.
Well, I have to confess myself that although I know a lot about insurance, I know very little about the law. So we all complement each other very well, don't we, gals?
Yeah, that's why we got the law, your money, and you.
Yes, you. So, every year, beginning October 15th and going through December 7th, is the Medicare annual open enrollment period. And for people who are 65 and older, this is an important time period because this is the one time each year that they have a chance to review what they have for their Medicare insurance and to think about making changes to that.
Okay, so just stop right there. First of all, answer, do you have to be 65 or over? And what's the difference between Medicare and Medicaid? And do you have to be 65?
Okay, good question. Good question.
Three questions.
In most cases, to qualify for Medicare, you do have to be 65, but there are some exceptions. For instance, if someone has been on Social Security disability income for 24 months, 2 years, they're automatically signed up for Medicare. And there are other situations that also entitle one to Medicare under the age of 65, but predominantly it was meant for people 65 and older. And regarding Medicare and Medicaid, a lot of people get those two things confused. So Medicare is the federal insurance system, health insurance system, and it's designed to protect seniors and others who qualify. It gives them access to medical care and prescription drug coverage, just in the same way or a slightly different way it works, but similar to what they would have in any other type of health insurance, for instance, a government.
You're still paying for it though, Camille. They still pay for it.
They do, yes. For Medicare, there are two parts. Part A, which is hospital and other types of inpatient insurance, and Part B, which is all outpatient services like doctor visits, outpatient surgeries, testing, etc. Now, for most people, Part A, you do not have to pay for as long as you've paid into the Social Security system. You don't have to pay as long as you've got 40 quarters or 10 years worth of experience in your field. But if you've worked, say, for the state or for a municipality where you don't have Social Security benefits, if they have their own pension type systems, then if you wanted to sign up for Part A, you would have to pay. Secondly, Part B, on the other hand, does require a premium. And people pay the standard premium, which this year is $144.60. But people who have higher incomes also pay more than that. They pay what's known as an income-related amount, and that is tagged on to your Medicare Part B. So yes, you do have to pay at least for the outpatient coverage.
Hmm.
And you wanted to know about Medicaid versus Medicare. So Medicaid, on the other hand, is the health insurance system, and also it is other types of services, but for our purposes today, insurance, that is subsidized by the government, and eligibility is based on your income. It has to be below 400% of the federal poverty level in order to qualify. So
What's the poverty level now?
I knew it yesterday,
1,000?
but I can't remember. It's pretty low. It's pretty low. So I have to look it up. There are tables that tell you all that stuff. But you do have to meet those income guidelines in order to qualify. And then depending on what degree of income you have, you're entitled to various levels of support with Medicaid. That might be paying your Part B monthly premium. It may be, some people even have access to health care without having to pay for it because they're financially unable to. So that's more of a support type system that benefits people who generally have lower incomes and less able to pay.
What do the pilgrims do?
Well,
Hi.
I think they ate a lot of turkey, and turkey has this tryptophan, so it helps people. Maybe it helps them with their immune systems. I'm not sure.
I wonder if there's
Camille.
wild turkeys out of the parts of the country besides here. They seem to be growing.
Yeah,
They're everywhere here.
You know, Becca
Camille,
had a few good questions.
I have
Go
a
ahead.
couple of
Yeah,
questions.
go ahead.
The first one is, if you don't sign up at 65, are you penalized somehow? Like, could I sign up at 66 or 67? What's the cutoff is 65 to ever get it, or how does that work?
just like every other question of Medicare, it depends. What happens is,
Right,
yes, you are entitled to it when you turn 65.
right,
And however, if you already have insurance, let's say you're working and you have it through your employer,
Right.
then generally speaking, you don't have to sign up when you're 65, as long as the coverage from the employer meets certain standards, which they call creditable coverage. Means it's comprehensive coverage, and it covers all the basic things, and usually it includes prescription drugs. So let's say you decide to work until you're age 70, then you really don't need to sign up for Medicare. It doesn't mean you can't, but your employer insurance is your primary coverage. As long as you're still working, you can have Medicare as secondary, but you're not required to.
So you can defer Medicare, signing up for Medicare until some later point, like 70, when you retire.
Exactly.
And then you can get onto Medicare.
That's
Okay.
exactly right,
And
yes.
keep your private health insurance going. Okay. But so you don't have to pay both, right?
Well, if you're
Better.
retired,
Right.
let's say that your employer has a retiree health insurance plan. When you're retired, you are required to have Medicare before any other type of insurance will cover. So if you want to have that employer health plan,
Right.
you still have to have Medicare as your primary insurance, and
see.
the employer plan is secondary. And a lot of people don't realize that. Sometimes their benefits department may not inform them of that, and then they do have to pay a penalty if they wait too long.
I see. Okay. You just answered my second question, which is you can have both, but then Medicare probably is the primary source, and then whatever's left over of the bill, your secondary private health insurance might pick it up.
That's
pick
right.
up the balance.
That's right.
Okay.
Yes. But when you're still working though, you don't, it's the opposite. Your company sponsored insurance is your primary, and then if you have Medicare, that's secondary, but it reverses when you're retired.
What about prescriptions? Which is that under?
Well, that is called Medicare Part D, prescription drug coverage. And there are approximately 24 or so prescription drug plans in just about every area of the country. And so what happens is the pricing and all the formularies are very different from one company to another. So the way that we try to match the right insurance plan to the person is by finding out what prescriptions they take regularly, the maintenance drugs. And we sort of do an analysis in the Medicare system that allows you to get some pricing estimates on the prescriptions you take regularly. Now, of course, we don't know what prescriptions you might take in 6 months, right? But that's something we don't know, but we can at least take a snapshot in time and know, based on what you currently take regularly, this is what you would expect to pay, and this plan is the most cost-effective for you.
That's interesting.
And now,
So Medicare, you pay for Medicare, like the 144, say, that you just talked about, plus an additional plan for prescriptions?
that's right. And there's also a third piece. I like to call it a three-legged stool, because you have your Medicare Parts A and B, which is subsidized by the government. Then there's the Part D prescriptions. And then there's also the medical insurance that supplements or wraps around Medicare. And that is typically a Medicare supplement plan, which is also called Medigap insurance. And the reason it's called that is because Medicare itself, Parts A and B, pay about 80% of your medical bills. It doesn't cover prescriptions. That's why you have a prescription drug plan. But for medical costs, Medicare pays about 80%. And in the absence of anything else, you would be responsible for the remaining 20% of any medical service. Now, if you're in pretty good health, that's not a huge burden. But let's say you have a serious condition or you have a terrible accident and your medical expenses are sky high, then that 20% can be a problem. So the insurance industry offers Medicare supplement or Medigap insurance to help pay for what you would normally have had to pay during that gap between the 80% and the full cost.
Who offers the Medigap? The insurance companies?
The insurance companies offer Medigap, and they offer the prescription drug plans. So Massachusetts, for instance, we have Blue Cross Blue Shield in Massachusetts, and there's a number of others that offer these Medigap plans. And for people who want that extra layer, it's a very good idea. Now, in addition to that, this is another option. There's also called the Medicare Advantage plans. You probably see tons of ads already on TV. Right. And those plans are kind of a package deal where they combine Medicare Parts A and B and Medicare Part D. It's all in one package, so it covers the medical services and the prescriptions. It's known as Part C, and that confuses people even more than it's already confusing enough. But
does this change every year? Or if you set 1 year, you should be set forever? Or does it change every year?
What do you mean it changed? You mean what they have?
What they offer?
Yes and no. In the Medigap side of the business, it doesn't change that much. But for the Medicare Advantage plans and the prescription drug, yes, they change every year. New plans come out. Maybe the coverage that you have now for your prescriptions may or may not be the best fit for next year, because either you might have changed prescriptions, or even if you haven't, the companies might have changed. There's a lot of new prescription drug plans that come out every year, and the coverage on the one that the insurance, the prescriptions you have now may not be the best coverage. So we offer our clients the option to have us review their prescription drug coverage every year to see if it's still the best fit. And for those who have Medicare Advantage plans that include prescriptions, the same thing.
Now, if you're not sure what you have, that's another question. But we just got big folders in the mail, like with a small print and lots of pages about your changes to 2021.
Yes. Those are required. Those are called the annual notice of change. That's the generic name. And what it is, it's they're required to tell you, the insurance company is required to inform you that the current plan you've had, these are the things that are going to change. It might be a different premium for it. It might be, the coverage might have changed. If it's a prescription plan, it's very important to know what they're changing, because some of the drugs that have been covered, say as a low tier, inexpensive generic, it might be different this coming year. So you have to pay attention to that.
What about these plans? And I always wonder, we got friends in Rhode Island, they get on these plans and they said, well, it's still Blue Cross, where they don't pay a penny in premium. They have this, if they they have like 400, she said this year it was $400 in credits on a health plan. So they bought Apple Watches, they joined health things, and as long as it adds up to 400, it's free. What are these free? And then they advertise that too. Your premium will be zero. How do they do that? Premium zero, how come I can't get on something like that?
Well, we have those in Massachusetts too. We have zero premium Medicare Advantage plans with Blue Cross, as a matter of fact. The way it works is, you know, the insurance companies are always going to make a profit.
Right.
Nothing's free. So what happens is there are plans out there that have a zero premium, and some even have a zero deductible. But what happens is you pay for your medical services as you use them. So when you go to the doctor, you pay a copay. If you have surgery, you pay a copay, or what's known as co-insurance, where you pay a percentage of the cost. It's a pay-as-you-go program rather than the other type, the Medigap plans, which you pay more upfront in your premium, but you pay very little or close to nothing in your expenses as you use the medical services.
Yeah, they even have something for, you know, when you leave this world, the funeral expenses, they have their bodies donated so that it won't cost a penny.
Yeah, I mean, there's all kinds of bells and whistles and perks to the Medicare Advantage plans. And I mean, it isn't that one is better than the other. It just depends on what's important to you. And some people, even though they might be in good health, and let's say they could definitely opt for a Medicare Advantage plan, because if they're in good health, very often their expenses won't be that high. But sometimes they just don't know. Suppose they have a terrible accident or they're diagnosed with a terrible disease, then it could get more expensive. So some people are risk averse and they like to have the reassurance that most of their expenses will be covered. And other people, they say, fine, I'll just go along with it. I'll go ahead and pay as I go. There's always an upper limit. There's always a safety net where if your out-of-pocket costs exceed a certain amount, then you don't have to pay anymore. So there is that, but still, it's just a question. Right.
Well, somebody sent me in a question about chronic diseases like psoriasis, just chronic, that constantly reoccurring. It's never going to go away. What is the story on that? They're worried that their health benefits are not going to be there anymore, or it's very expensive. They end up sometimes paying $100 every 2 weeks. It can be expensive. Is there any news on that, or is there any hope?
Well, for right now, particularly in Medicare, you know, chronic diseases, just like anything else, is covered. So if you go to the doctor periodically or every couple of weeks, it doesn't matter. It's still going to be covered. And prescriptions that you take, they're going to be covered as well. Sometimes it's expensive because then they may be brand drugs. We have a client who is going to be going on to an expensive drug for psoriasis, as a matter of fact. So there's not much we can do about that. It's just the cost of prescriptions, and depending on you know, where you are in the Medicare cycle, there's a period known as the coverage gap or the donut hole, where you pay more for your prescriptions. But we evaluate these things with people so that they'll know what to expect. Now, what you may be referring to is the Affordable Care Act, and there's a lawsuit now that the Supreme Court is going to be hearing. They're going to take it up the month after the election, where they're going to consider whether the Affordable Care Act is constitutional or not.
They all call that Obamacare too, right?
Yes,
lots of things. Yeah. So with the election, what is the case? Tell our viewers about this case.
Sure. So this case it started in Texas, but then the attorneys general of, I don't know, 17 or so states, I can't remember the exact number, filed suit because the ruling in Texas was, and please, I'm not 100% sure of how this part worked, but the suit was to challenge that the Affordable Care Act is null and void. And
The
the
whole
reason for that,
thing, the whole thing?
well, yes, and this is why,
Yeah.
because what's called the individual mandate, meaning that everybody was required to have health insurance,
Right.
the individual mandate was discontinued beginning in 2019. And so the lawsuit was based on the fact that the individual mandate was a principle, was one of the foundations of the law. So they were saying, well, if you don't have the individual mandate, the whole law is null and void. Where it stands today, though, is the Supreme Court is going to consider whether it should be considered null and void. Should the whole thing be struck down or not? And the people
Over that one thing.
over that one thing, but the consequences, if it is struck down, that people out there who have pre-existing conditions are worried, because the other big protection with the Affordable Care Act is you can get insurance even if you have pre-existing conditions, and these people are afraid that might end, and they may have difficulty finding insurance.
Why can't they just, I remember looking, I used to be able to do the taxes, but I remember there was one fellow that he said my taxes are more because I don't already have health insurance. And they
Yeah.
said because I'm supposed to have it, I'm penalized. Massachusetts penalized them. I said, well, we've got to get you fast. And it was a difference. It was quite a few $100s.
Yeah.
But I mean, he was a young fellow, they don't go to doctors anyway. And,
Right.
usually they don't need it. But why can't they just down that portion of it, of the act? Why make the whole thing?
I think that's the argument.
Yeah, that is the
That-
argument. Yeah. That's the argument, because
That's exactly the core of the argument. Is side is saying the whole thing needs to be struck down. The other side is saying only strike down the portions that are unconstitutional, but keep everything else in place.
Yeah,
Right.
that makes sense.
I don't know if that also includes that children are covered until they're 26.
yes.
I think so. If that's
Yeah,
struck
that was the
down,
whole
that means a
thing.
lot of students,
Yes.
anybody who's doesn't have their own,
Yeah.
health insurance,
Exactly.
and relying on their parents, they're going to lose that as well.
Right.
That was Michael, Becca's husband, who should have been gone in the Amazon.
Sorry.
That's funny.
Yeah. So that's going to be a big deal now, depending on what
It's
happens.
funny, yeah.
Now that whenever they decide about this, I think they're just taking up oral arguments in November.
That's fascinating.
It's a very
That's
big
Michael.
political
Michael
issue.
used to be with, can I say it? And he used to be with the Borderland State Park. And if you ever listen to any of his lectures and had gone to camp as a kid, he will bring you back there with the way he's enthusiastic. What do I call him? A male Mary Poppins. Rebecca's so lucky to have him. And he
Yeah,
doesn't eat
we're like
that
Peter
much.
Pan.
Like Peter Pan. But
Yeah.
anyway, we, believe it or not, we only have 5 minutes. But you know what? Like anything else, there's always scams born on it. And I get a call twice a day from one of these insurance companies. So I couldn't take it anymore. And there's only so many numbers you can block. So anyway, they say, is this Roberta Saphire? Usually say no. Well, can you take a message? No. And twice a day, and they don't even use different phone numbers. So this time I said yes. So that's why I say you got to watch out for the scams. So the first question they say, well, to be sure it's you, what year were you born? And that's the beginning of a scam. So tell our viewers, watch out, because there are scams for everything. So, and I always tell people, you can ask me anything except when I was born. So I wrote in 1492. They tell you to put it in, and the recording, because you don't talk to people, the recording says that does not sync with our information. But that's funny. So we got to watch. But before you wind up, and Camille, you can still do the honor of winding up. Is there anything else that we should add on scams of people to watch out for? If you have a question, you can get a hold of Camille or get a hold of me or something.
Oh, yes, definitely.
Because she is the expert.
Well, I don't know about being an expert, but
I
I've been in
think
this
you
business
are.
for a long time. So yes, if any of our viewers, if you have any questions about health insurance, please send us an email and we'll happily get back to you because this is a very important topic. I mean, let's
Right.
face it, if without your health insurance, you cannot really plan your life.
I know,
So
isn't that something? And there's
yeah.
so many people. But I thought that thing too, getting back to if you don't have the health insurance, I thought that was by state, not by federal.
What do you
Like
mean?
that you don't have to have it if you don't want it.
Well, the federal mandate that you must have it,
Oh,
that
it's
was struck
federal.
down. So it is federal. You know, Massachusetts was kind of the prototype, if you will, of government health insurance under 65. So we've been at it a long time, but yeah, I mean, you're no longer required to have it. That's the bottom line.
What do you think, just before we go quickly, what do you think of where everybody has health insurance and everybody has medical insurance? For
What do you mean?
free, for free.
Oh, well,
Like a national health care.
yeah.
Yes, national.
You know, you really have to look at the outcomes in those places. The United States actually is the most expensive healthcare in the world, and
Really?
our outcomes are not very good compared to other countries. So if you draw if you draw the correlation between the two, it may not be because we're the most expensive, but I think that we really have to examine the whole system. And maybe there are good things that we could learn from others, may or may not be completely public health insurance, but somehow or other, we have to improve the outcomes in this country.
Yeah, it's not just medical insurance, it's a state taxes, this tax, that tax, every other tax.
Mm.
What are you gonna do? So anyway, thank you so much, and thank you, Becca, for joining too. You had some beautiful
Thank you for
questions.
having me.
No, you're
Right.
welcome. And do it, Becca, in the next newsletter, you can do a good write-up on this particular show.
Okay.
Okay,
Yeah,
well,
it's fun.
thank
It's
you.
great to have been a guest today instead of one of the hosts. So
Yeah,
thank you all for watching, and please let us know if you have questions or you have any other topics that you'd like to know about, because remember, this is your show, the law, your money, and
and
you.
you.